performing diagnostics, prescription, prognostic, and potentially surgery that could lead to actually being sued, if the algorithm has not been assisting them. Cosmetic use of genetic engineering. I mean, people are now starting to explore area where you can change your hair color or your eye color thanks to a skin complexion through genetic modification. What about the ethical implication? We also don't know the medical implication of those. And then, of course, general genetic engineering is a big challenge that we just talked about. Let's explore a couple other areas around innovation. How do you think we should regulate a self-improving algorithm? So let me just frame it. We talked in a previous video about the fact that with machine learning, algorithms are constantly improving and learning, right? So you're going to go to an authorized body, let's say EMA or FDA. You're going to get the algorithm approved. But then the algorithm is going to be evolving over time, learning from data. So the algorithm at a point A is going to, the approval point A is going to be different that in point B, after maybe let's say 1 or 2 years of practice, the algorithm will have learned and it's probably slightly different, which is normal. We do that for drugs as well. We monitor safety events, adverse events. We do post-marketing monitoring and a large number of activity. We may need to think about how we apply those technology, those frameworks in a simple way to those new digital solutions. Should we treat an algorithm like a prescription drug? Is it the same pathway or is it a digital health pathway? We really should start looking at what are the best way to treat those algorithms and how they apply. An interesting one in the field of social media is Microsoft created an AI bot, which objective was to exchange with people on Twitter. And the name was Tay. And Tay was very nice and sweet at the beginning for a few days. Hey, nice to meet you, great to hear about your passion, etc. But Tay was learning from social media data, so people exchanging on social media. And we're humans, so racism and many other nasty things are happening on social media, problem against diversity, homophobia, etc. And so what happened is gradually the algorithms start learning from a data set that represents human behaviors. And that data set was containing some of those poor behaviors. So within a matter of days, the algorithm starting to become racist. Selecting certain genders versus others and making nasty comments. So Microsoft had to take it out offline because it was actually learning from a data set that was inherently human, which is unfortunate. How do we do this? How do we manage those implications? Amazon, for example, with the HR department, about a few weeks ago, was actually had to stop an algorithm which they used to optimize the HR process. And I think that was well intended. The objective was to select the best candidate, and you have limited resource. The problem is the algorithm, although well designed, was using data from a given department in Amazon. And in this area, it was mostly white Caucasian male. So there was for 80%, I think 70 or 80%. And so what happened is it was inherently biased because that's the nature of the department. So the algorithm started to reject female CVs in a higher number than the male CVs because it was not one of the criteria, the feature that was elicited by the algorithm in the analysis of the CV. So they had to take it offline as well because it was creating a gender bias. In Saudi Arabia last year, a robot was become for the first time a citizen. Oh yes, Sophia has a Saudi Arabian passport. Now that's creating challenges. I mean, she has a passport, can she travel? Does she have robo rights? What do we mean by robo rights anyway? Have we really defined this? I think it's very interesting, fun, but I don't think that prior to doing this, we have realized and we may the ethical implication, and we may starting to set precedents without having really sat down and thought about those implications. The complicated truth about China's social rating or credit system that you may have heard about, where they're collating large amount of data on citizens and then creating a rating systems. What are the ethical implications of that? There are, pros, you can imagine, driving good behaviors from a societal perspective, but there may be some issue from a, democracy or privacy perspective. Imagine the implication of facial recognition and systemic data collection on citizens, patients, and many other individuals. That could deprive them from fundamental rights. We need to make sure that we also carefully understand the implication of virtual reality and augmented reality. We're only starting to see for the last 10 years, especially through video games and other solutions, full immersion of especially young individuals and teenage, but also more and more the 30s and the 40s are actively playing, leveraging those technology. We're starting to see impact of virtual reality, augmented reality, and those video games on the brain and the functioning of the brain. Without you realizing, utilizing your phone every day, you're probably, delegating a lot of your memory to Google, and oh yeah, I'll Google that, I'll Google this. So you don't have to make effort to train your brain. So a part of the brain actually in charge of memory is probably, suffering from a small atrophy because you're not training, it's like a muscle, right? So you're probably training some new part of the brain. So it's likely that we are in the midst of somehow a brain evolution where we haven't fully mapped all the consequences of those technologies. And then, when we think about ethical dilemma, we talked about self-driving vehicle, we realize, for example, machine vision algorithms have an inherent bias. They are better at spotting light tone type of image versus dark tone of image. So that creates a consequence that if, let's say, a person with a black skin is crossing the street, he or she is more likely to get run over by an autonomous vehicle because of the inherent bias in the algorithm. So I'd like to conclude this section to ensure that, we all think from an ethical perspective on how to embed ethics, compliance, and risk management at the heart of everything we do around technology. Let's make sure that we understand all those technology to a sufficient level of depth so that we can understand the risk. And the spectrum of risk is actually evolving from a traditional, spectrum of risk, let's say, risk of off-label promotion, anti-bribery and corruption, transparency, into new areas. Think now about algorithmic bias on data sets, on humans. We talked about those algorithmic bias. And those algorithms are making decisions that could impact our lives or lives of patients across the world. Think about privacy, and privacy is a very interesting theme where, to be honest, I'm not sure we can have an expectation for privacy, but I'm not sure we have a lot of privacy really with all the data being collected on us. But there are areas we really want to protect, especially in the biopharmaceutical industry, where we're being entrusted with, sensitive health information from patients. We want to utilize this in a way that protect their privacy and maximize the healthcare outcome. Cybersecurity. A lot of those systems we describe and those frontier technology applied to healthcare are connected together to the internet and many other different systems. So that makes them more prone to cyber attacks. Safety, both physical and emotional. Thinking about, say a robot starting, killing people or injuring people, or, some of the algorithm that we interact with on a daily basis starting to having, negative impact on the brain or on our emotional situation. Beneficence and human well-being. Not only we want to make sure they're actually not injuring us, but they're also fostering, our well-being. And that's what we call a perception of beneficence of AI. We want to make sure they're not only here to reduce the occurrence of harmful utilization, but also of beneficial utilization. What about explainability of result? One of the challenges we talked about in a previous video on artificial intelligence and deep learning in particular is that, if you remember in the neural networks, you have the input layer, the output layer, and then a lot of information being processed in the intermediary layers. We don't sometimes really know what's happening. We had situation where, last year at Google, they were doing a test with two algorithms negotiating, I think it was apple and pears. And one was trying to get more apple and the other one more pears. And before they realized, the two algorithms were talking together in a language that the programmer could not understand. It became apple, apple, pear, 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 apple, pear. And then before they realized, they just had to unplug the algorithm because it could actually bear some risk that it could just go out of control. So there are a lot of issues around what we call explainability or the black box concept, where we need to make sure that AI not only is producing analytical work for us, but is also explaining to us how it came to that conclusion. And that's very important because it will help us better trust the system, and the trust is essential, especially in our industry, so we can deliver digital health solution that can be trusted by patients thanks to the explainability. And of course, transparency of decision. Once we understand those decisions, we need to communicate them in a transparent way. If you're interested in learning more about those technologies and their application, please check out my other videos on the topic. Thank you very much.